Calling the 1 o'clock Health and Human Services hearing today at 1 p.m., March 20th, 2026, room 225. Just me right now, but hopefully we'll get quorum before DM. This meeting is being streamed live on YouTube. In the unlikely event that we must abruptly end this hearing due to technical difficulties, committee will reconvene to discuss any outstanding business later at 1:46 p.m. Monday, March 23rd, 2026 in room 225, this room. Public notice will be posted on the legislature's website to facilitate this hearing in a timely manner. We will be enforcing a 1-minute limit on testimony. I will be reading a list of individuals who submitted written testimony for each measure. We apologize that closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you the committee does have your testimony. I've reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. First up, HB 1626, relating to youth penalties. First up, we have Office of the Public Defender in support. Okay, not present. Office of Hawaiian Affairs in support. Okay, please proceed.
Aloha, Chair, Vice Chair, and members of the committee. McKenna Woodward on behalf of the Office of Hawaiian Affairs in strong support. Native Hawaiian youth are disproportionately represented at multiple stages of Hawaii's juvenile legal system. Financial sanctions compound that disparity and can function as an early driver of deeper system involvement. Judiciary data show that youth fines have low collection rates and limited deterrent value. Instead, they prolong court involvement, shift debt to ohana, and operate as a poverty penalty rather than a meaningful accountability tool. This bill shifts accountability toward community service, restorative practices, and INA-based programs that strengthen connection to culture, place, and community, while ensuring that community service does not interfere with school or work. This bill also promotes fairness and consistency by eliminating uncollectible legacy debt and aligning Hawaii with national best practice. For these reasons, we respectfully urge the committee to pass this bill. Mahalo for the opportunity to testify.
Okay, thank you very much. Next up, we have Judiciary and Support, Keith Hayashi. Let me make sure I got it, 1626. Yep, Keith Hayashi, Department of Education, providing comments. Okay, Aubrey, Kealoha, Haley, Kealoha, O Hawaii, Manuel of Naopia, bye-bye. Are you present on Zoom, any one of those three?
Aloha,
No?
I'm here.
Okay, please proceed. Identify yourself.
Aloha, I'm Aubrey Kealoha. I'm 17 years old and I attend Kamehameha Schools Kea'au, and I stand in support with this bill and I stand with my written testimony. Mahalo.
Thank you very much. Abra Green, Libertarian Party of Hawaii, in support. Brittany Kealoha of Ekolu Mea Nui in support. Brittany, are you present on Zoom?
Yes, aloha mai. My name is Kalei Kealoha, Brittany Kealoha. I am the co-executive director for Ekolu Mea Nui, and I too stand in support of my written testimony to support this bill. Mahalo nui for.
Thank you very much. Jamie of Ekolu Mea Nui in support. Jamie, are you present on Zoom?
Yes, I am. Aloha, I'm here. Thank you for proceeding with this and hearing this this important bill. And I
Could
stand
you
on.
identify yourself, Jamie?
I'm Jamie. Yes, Jamie Miller, and I stand on my written testimony. Aloha.
Thank you very much. Next, we have Donovan Kamakani Albano of ACLU in support. Cameron Clark, Deputy Justice Hawaii, in support. Melissa Pavlicek, Opportunity of Youth Action Hawaii, in support. Deborah Spencer-Chan, Adult Friends for Youth, in support. Halekipa of Venus Rosette Medeiros, in support. Carrie Ann Shiroda, are you present on Zoom? Please proceed.
Yes, I am. Aloha, Chair. Carrie Ann Shiroda in strong support of this measure. Just really quickly, for 3 reasons. It helps to eliminate recidivism. It addresses systemic inequality in our community, and it promotes restorative alternatives. And I thank you so much for holding this hearing, and I hope everyone stays safe and healthy. Mahalo.
Thank you very much. Carla Allison in support. Anybody else wishing to testify on HB 1626? Okay, I don't have any questions, so moving on. HB 1643, relating to pharmacy. First up, Christopher Fernandez, DCCA Board of Pharmacy, providing comments.
Good afternoon, Chair. The board stands on its testimony supporting the intent.
Okay, thank you very much. John Kuritsu of Kaiser in support.
Good afternoon, Chair John Kimber, Supervisor. We're standing on testimony requesting an amendment. Thank you.
Corey Sanders, Hawaii Pharmacists Association, in support.
Good afternoon, Chair. Corey Sanders, Executive Director of the Hawaii Pharmacists Association. We're okay with the amendment that was proposed by Kaiser. I also wanted to answer some of the questions that were suggested by HMSA. We're not under the impression that any of the things that we proposed in this bill will be in confliction with some of the federal guidance that's coming out in 2028 and 2029 for auditing procedures. And then some of the comments from PCMA, their proposed amendments, asking that we do not take a proposed amendment G. Our island pharmacies are small. They're very small staffed. We're asking that the auditors aren't allowed into the prescription area as there's normally HIPAA information that's outside of the audits. So we've got other spaces we can put them in that wouldn't allow the staff to have to stand and monitor them and take away from the workforce. And then the other amendment that PCMA proposed, just asking for some additional time before the next hearing so I can get back with my independent pharmacies on how that would affect the process. Wasn't able to reach them this morning. I think everyone's just trying to keep their heads above water. So thank you so much for hearing this.
Thank you very much. Okay, next up, we have Kelly Go, pharmacist in charge of Molokai Drugs, Inc., in support. Kimberly Svetin, in support. Kimberly, are you present? Nope. Okay. Ronald Taniguchi, in support. Leah Nu, in support. Megan Arbels, in support. Moani Rist Van Alst of HMSA, providing comments. Okay, Tonya Neal, Pharmaceutical Care Management. Are you present, Tonya? Please
Yes,
proceed.
ma'am. Hello, aloha. My name is Tanya Neal. I'm the Senior Director for State
Can you
Affairs.
turn on your video?
I
Or you
think it
cannot?
is from my end.
Well, no, there's a storm, so go ahead.
Great. My name is Tanya Neal. I am the Senior Director for State Affairs for the Pharmaceutical Care Management Trade Association. We are the National Trade Association for Pharmacy Benefit Managers. We will stand on our written comments. Thank you.
Okay, thank you very much. Next, we have Adam Kialiher in support, Leanne Malapit in support. Anybody else wishing to testify on HB 1643? Okay, I don't have any questions that Corey didn't answer. So moving on. HB 1668 relating to Medicaid. First up, Daintree Bartolodus, Hawaii State Council on Developmental Disabilities, in support.
Aloha, Chair.
I see Shay, please proceed.
Hi, my name is Jay Silver. I'm with the Hawaii State Council on Developmental Disabilities. I'm here for Daintree Bartolodus. Apologies due to the storm. We're doing it via Zoom, and Daintree was called to one of the emergency shelters to support it. We appreciate that MedQuest has basically been able to fulfill the purpose of this measure, right? The program is live and going. But however, we still want to push that this measure is needed. We would like it codified in law. We would like it as a stopgap so that, if this program ever does want to be changed, it has to go through you folks. The reason I say that is, when we're trying to build employment for people with disabilities, it takes 5 to 10 years to build that trust, right? And if we rug pull them or things change with the new administration, complete respect to the current administration. We love working with them, but it's about the future, right? And building consistency in our state and building secure employment for people. And so for those reasons, I know we only have 1 minute. Our amendments are to reflect the current program that MedQuest has already put into place. We do not want to hamper them by this law going through. So that's all I'll say.
Thank you,
so much.
Shay. Next, we have Director Yamai, I see Meredith there for Department of Human Services providing comments. And Meredith, you heard Shay. What do you think?
I think Shay is fantastic, and we really want to recognize and mahalo, especially Shay's brother Cal, the inspiration for this program. Department of Human Services is so happy to communicate this as a huge win for the community. All of us together working hand in hand. Starting last year, we actively put in a state plan amendment request to the Centers for Medicaid and Medicare Services to remove any limit to the income, and we added remove any limit to the resources. We want to keep folks in our community who are working working, if that's what they're able to and choose to do. And we take this as a huge win. We just received word on the 17th, so that was just this week that CMS approved it, and we couldn't be more delighted. So again, gratitude to everybody for helping us cross this important threshold.
Thank you very much.
Mahalo.
Next, we have Christine Pagano, DCAB in support. Louis Urchik, Hawaii Disability Rights Center in support. Please, come on up.
Good afternoon, Senator.
I want the question answered, which is basically, why do we need this? And what Shay said, that they want it in codified even if we have it.
Right, and that's one of the things that I wanted to talk about, and I was actually hoping everybody would be here. But I mean, the bill in front of you obviously is the bill that we talked about when we had the Medicaid buy-in, so we're happy to have that. We're delighted that, and I really appreciate what Meredith did getting the CMS waiver. We would like to add the asset disregard as well. So it would seem to me that the best answer I can give you without further research would be that, so here's the waiver that they submit to CMS, they get the waiver. The waiver can expire, it's a short term, it's a 5-year waiver perhaps. There's nothing, so if we codify it in state law, then it would require them to continue to do that. I mean, Meredith has been, I've got to tell you, I mean, all my years, she's been the most supportive MedQuest director I've ever worked with.
Terrific, thank you very much.
So what happens next time? So I think this will enshrine the protection forever.
Okay, thank you. Next, we have who has registered, Janelle Fiesta in support. Janelle? Is that you, Janelle? Okay, please proceed.
Chair, my name is Janelle Fiesta, born and raised in Honolulu, Hawaii. Thank you for giving me the opportunity to testify in support of HB 1668. I live with a neuromuscular condition called spinal muscular atrophy, and because of it, I have lost most of the motor function that I have. I use a power wheelchair, and I rely on caregivers every day to help me with activities of daily living. Medicaid is essential to my survival, and through Medicaid, I receive caregiving attendance services that make it possible for me to live and work in the community. Whether I work or not, I will always need Medicaid. And this goes for other working people with disabilities just like me. CMS recently approved HHS's plan, a state plan amendment to remove the income and asset limits for particular work participants retroactive January 1st, 2026. It's so crucial that we get HB 1668 with the amendment of the removal of asset limits passed to have these rights codified into law. I respectfully ask for your support in amending and passing.
Thank you very much, Janelle. Next, we have Kylie Swan. Kylie, please proceed.
Good morning, Chair, Vice Chair, committee members. My name is Kylie Swan. I'm a strong supporter of this measure. I have an intellectual disability, and I'm also on Medicaid. I like working at my job at James Campbell High School as a classroom cleaner. It makes a sense of purpose. But right now I cannot work full time as it may affect my services. I want all my friends to be able to work too. Please pass this measure and they can allow to testify.
Thank you very much.
If you have any questions.
Okay, thank you. Next we have Deborah Kobayakawa. Deborah, are you present on Zoom?
Not present, Chair.
Okay. We also have Hawaii Self-Advocacy Advisory Council in support, James Kilger of Full Life in support, Hawaii Self-Advocacy, again, in support, Aloha Independent Living Hawaii in support, Annette Tashiro in support, 1, 2, 3, 4, 5, 6, 7, 8, 9 other individuals, all in support. Anybody else willing to testify? Angela, I thought you're no longer testifying. Okay, well, please proceed.
Someone has to speak up for this community, right?
Okay, they're all in support. Are you in opposition?
I am, of course, in support.
Okay.
And I feel like
Identify
it is
yourself.
my due diligence to speak up for those who are not able to. I'm Angela Melody Young, and I'm an individual with lived experience. And so I work at the Hilton Hawaiian Village in fashion part-time, and working is important to me because I want to make a living as I survive my health complications, because I have to go to many practitioners in various fields for healthcare, in cardiology, orthopedics, vision. And so I have to have Quest integration because there's no way that I can, it's like having cancer, stage 4. And when I explain this to my students, my elementary school students, they're like, oh my gosh, our teacher has cancer. Yes. It is very severe. So I have to get consistent diagnostic scans, services, and treatment. And there are many barriers that the offices, I think, should collaborate more on and have more overlapping work between Quest and
Thank you
BESD.
very much, Angela.
Yeah,
There's
so that-
nobody in opposition.
Okay, thank you so
thank
much.
you. Anybody else wishing to testify on HB 1668? Members, any questions? Meredith, are you still on? Meredith?
I am, sorry.
Okay, so my big question is, and thank you very much for getting CMS approval for this. It's what Shay said, and Louis Urchik also said, that we need to codify this. Do we need to codify this? And if we codify this, what are the consequences if it's already duplicative? I mean, it doesn't seem like there's any harm.
Yeah, I don't think there's any harm. I do think, so this state plan amendment, we're required to get CMS approval to do what we were able to accomplish through this bill. And that if CMS were to change their mind, and I'm not sure if Shay was referring to the administration like federally or DHS MedQuest, but so CMS has the full control, and it's not just a waiver, right? This is our actual state plan amendment that has changed. So it's not a limited time sort of thing. It's our actual state plan that we amended to remove we requested to remove both income and resources, and to make it retroactive as of January 1st of this year. So all of that is now in place. The only thing
So here's the question then. Okay, if we pass this because CMS approved your request, it doesn't look like it's going to hurt.
It won't
But
hurt.
if for some reason CMS changes its mind, I personally don't think so, because I think it's as bad as it's gotten. Is state of Hawaii then on the hook to pay for the Medicaid?
That's correct. So if there was no federal support, then what we would have to do is come back, should that go away, then what we would have to do is come back with a new bill anyway, because it would require an appropriation to fund. So I think that
because it's in the bill. I mean, if we pass the law, then all the request is just going to be a budget line item to continue funding.
Exactly.
Right. I don't think we need another bill. It's just a budget line item.
Yes.
Okay, thank you.
Yep.
Okay, I'm the only one asking questions, so we're going to move on. Okay, next up, it's HB 1550. First up, Uniform Controlled Substance Act, drug paraphernalia relating to health. First up, we have SHPTA in support.
Senator, aloha. Thank you very much, Dr. Lewin, representing SHPTA. And we are in support of this bill. We stand on our testimony.
Okay, thank you.
Unless you have questions.
No, I'm fine. Thank you very much. Next up, we have Department of Health in support. Aaron Rudek in support. Russell Abordo in support. Thaddeus Brown in support. Zachary Fraser in support. Nandy Fernandez of ACLU in support. Nicholas Leverins. Okay, please proceed, Nicholas.
Aloha. Aloha, Chair and members. I guess there are no other members there. Good to see you again. Nikos Leverins with Drug Policy Forum of Hawaii in strong support of this bill. This bill is needed to ensure that our syringe access program, our statewide syringe access program that Dr. Lewin helped shepherd through 35 years ago, can be responsive to the needs of the community here. In Philadelphia, for example, they have medetomidine popping up. We have some xylazine popping up in our syringe exchange program, access program now. And this bill is necessary to help ensure that service providers and the Department of Health can have the flexibility to respond to the community's needs. Mahalo for the opportunity to provide testimony.
Okay, thank you very much. Next, we have HB 19. Anybody else wishing to testify on HB 1550? Okay, I don't have any questions, so we're moving on. HB 1974, relating to health. First up, SHPTA in support.
Senator, thank you. Jack Lewin, representing SHPTA. I'm going to come up just to make a few comments. We really don't have in our state a real plan for hearing loss. We used to, test every keiki. We don't even do that now. And kupuna have really a lot of issues with, but we have midlife people with severe crisis and sudden hearing loss, and they're just navigating a nightmare trying to get services and get their hearing restored. We have, I hope there's a testifier here today from one of our councils who experienced that personally. This is a $100,000 request, and it's really to get a state plan. We can come back and really have understanding of how many people are affected and what we need to do to deal with it. So this is not a services program, it's really a planning process that is sorely needed.
Thank you very much. Okay, next up, Carolyn Kadirao, Executive Office on Aging, providing comments. Rick Tabor for Babea in support. Tori Carapelho of Here for Hope.
Aloha, my name is Tori Carapello and I'm founder of Here for Hope. And I come before you both as a community advocate and someone with lived experience. In 2021, I suffered from sudden hearing loss. I remember being told that there was nothing more that could be done and that this was something that I had to learn to live with. In that moment, I wasn't just losing my hearing, I was losing my confidence, my independence, and my quality of life. What made it even harder was realizing that there was no clear path forward. The diagnosis was addressed, but there was no roadmap. No coordination, no guidance, and no clear place for people to turn for me to turn to for support. That experience led me to start Here for Hope because no one should have to navigate hearing loss in such a fragmented system. Hearing loss affects far more than just hearing. It impacts communication, employment, independence, and quality of life. And as Hawaii's population continues to age, these challenges will only grow. House Bill 19.
Thank you very much, Tori.
Thank you.
Okay, next we have Kobe Chalk, Alzheimer's Association in support.
Senator Wilson on our written testimony in support. Thank you.
Thank you very much. Next, Catholic Charities in support. Lance Tanaka, another Here for Hope in support. Dr. Hadley for Hawai'i Ear Clinic in support. Leilyn Brady, Aloha Independent Living Hawaii in support. 3, 4, 5, 6, 7, 8, 10 other individuals, 13 other individuals, all in support. Nobody in opposition. Anybody wishing to testify on HB 1974? Okay, seeing none, moving on. HB 1858, relating to vital statistics, Department of Health in support.
Department will stand on testimony in support. Apologies that this is regarding the second late testimony.
Thank you very much. Yasmi Chin, Hawaii State status on the status of women in support. I don't see her here. Joy Vink, Kapiolani Medical Center for Women and Children in support. Joy?
Hi.
Please
Hi,
proceed.
Chair. Thank you. Can you hear me? Oh, sorry.
Yes, please proceed.
On the phone. Thank you so much for the opportunity to testify. I stand in support of my written testimony. My name is Dr. Joy Vink. I'm one of the high-risk OBGYNs at Kapiolani Medical Center, who unfortunately deals with fetal death quite a bit, and we're seeing a lot of it in our hospitals. And the goal of this bill is to really focus on how we can get better data about spontaneous fetal deaths, because right now our data at a state level is not usable. So as clinicians, we do not have the data that we need to really go back into the community and start figuring out why these fetal deaths are occurring and how we can prevent it. So unfortunately, I know that the term fetal death has come up as, particularly concerning. I do want to note that it is a term that is our standard medical term. It is also the term that is used by the CDC and one that we recommend using for clarity purposes. In addition to that, there are many causes of fetal death that are preventable. What I'm seeing in the hospitals
Thank you very much, Dr. Bing.
Okay,
Next,
thank
we have
you.
ACOG, American College of Obstetrics and Gynecology. Dr. Bravo, are you present on Zoom? Please proceed.
Yes, I'm right here. Hi, Chair and members of the committee. My name is Dr. Malera Bravo. I'm representing the American College of Obstetrics and Gynecology. We stand by a written testimony. I want to, just like Dr. Vink said, clarify that the term fetal death is the standard public health term used nationally by the CDC and other agencies to describe pregnancy loss. And it may sound clinical, but it's the consistent use that allows for accurate data collection and meaningful comparisons across states to improve maternal and fetal health outcomes. So I also want to thank everyone for having the committee today amid all the heavy rains and flooding. But ACOG Hawaii supports HB 1858. Thank you.
Thank you very much. Next, we have Ahuhui Ona Kaukad, Association of Native Hawaiian Physicians in support, American Academy of Pediatrics Hawaii Chapter in support, Hawaii Medical Association support, Kaiser Permanente in support, Sarah Harris in support, and Department of Health in support. Anybody, Department of Health, who hasn't testified already? That's you, okay, because I have you again. That's the one that you want to disregard, okay. And we have 7 other individuals, all in support. Anybody else wishing to testify on HB 1858? Members, any questions? Okay, seeing none, moving on. HB 1871, relating to health. First up, we have Department of Health providing comments.
We'll stand on our written testimony.
Thank you. Yasmi Chain, Hawaii State Commission on Status of Women, in support. Adva Ahmed, in support. Amanda Luning, Hawaii FASD Action Group, in support. Mally Callan, Diabetes Patient Advocacy Coalition, in support. Anybody else wishing to testify on HB 1871? No questions? Okay, moving on. HB 1966, relating to EMS, Emergency Medical Services Special Fund. First up, Department of Health, Garrett Hall, in support. Okay, please proceed, Garrett. You need to turn on your mic, Garrett.
Aloha, Garrett Hall, Chief of EMS with the Department of Health. My apologies for not being there. We're currently activated for the storm. And clearly I don't know how to use unmute. But we do stand on our written testimony in support of this. I know there was concerns about the procurement exemption, but we do have a strong history with the trauma fund that has allowed us to be very successful in growing our trauma system without any violations of that within our department and branch here. We ask for that same so that we can continue to purchase emergency equipment in times like this and during regular times without having to go through the onerous procurement process. Lives matter, and it takes time to purchase things. And when we go through the procurement process, sometimes we do not have access to the resources we need. Like now, we don't have access to a patient tracking system that we should have had in place because it's held up for a procurement violation. So I'm having to manually track all of our patients through this storm right now. So we really ask for your support in this. It will be extremely helpful for saving lives. Mahalo.
Thank you very much, Garrett. Next up, we have Bonnie Kahakui, State Procurement Office, providing comments. Tom Yamachika, Tax Foundation, providing comments. Please proceed.
Aloha, Colleen Taramai on behalf of Tom Yamachika, the Tax Foundation of Hawaii stands on its written comments. Mahalo.
Okay, thank you very much. Next, we have Laura Mallory Sayer in support. Anybody else wishing to testify on HB 1966? Members, any questions? Okay, Garrett, are you still on?
Yes, I'm here.
Okay, so I'm thinking about removing the cigarette tax revenue because I don't see any nexus on cigarette smoking and EMS.
Can we, yes, let's talk about that. So risk-taking behavior is directly tied to emergency response, and it is how it has been funded. We don't have another funding stream for that currently, so removing that would place a hardship on the current obligated funds that's going into the special fund. I don't disagree with you, but I would like to consider that for maybe the next session on how we could move forward without that. But at this time, we don't have a solution that would subsidize those tobacco funds that are currently obligated.
Okay, thank you very much. Okay, any other questions? Okay, moving on. For HB 1972, relating to taxation. First up, Pabea, in support. Department of Taxation, providing comments? No. Carolyn Kadirao, Executive Office on Aging, providing comments. Yasmi Chain, Hawaii State Commission on Status of Women in support. Audrey Suga Nakagawa, AARP in support. Come on up.
Good afternoon, Senator. I'm Audrey Suga Nakagawa from AARP, and AARP stands in strong support of this measure. We are very mindful of the fiscal challenges that's facing the state, and we deeply appreciate the legislature taking this bill into consideration. I just want to point out that HB 1972 provides a non-refundable tax credit worth up to 75% of eligible expenses, and which means that caregivers will have the skin in the game in terms of providing, having the type of care receipts and eligible expenses to be considered up to $3,000. We also know that this particular bill benefits those who really need it the most, and this is for those income under $75,000 for individual tax filers and $125,000 for joint filers. I just want to also point out that this bill complements the household independent care tax credit. So this covers those who are not working, and many of our caregivers have quit their jobs and are retiring and taking care of their loved ones. So this will help them, and they have to choose one or the other. It's not both. But finally, I just want to point out that this bill does not go into effect until after 2026.
Thank you very much, Audrey. Chris Cofield, Hawaii Public Health Institute, in support.
Aloha, Chair. Chris Cofield from the Hawaii Public Health Institute. We're in support of this bill as well. Caregivers are the heartbeat of our economy. In our state, there's more than 154,000 family caregivers. They contribute 144 million hours worth of care each year. If that was valued on the open market, that would be valued at $2.6 billion. There's just so much work that's being done unpaid in our community that's so essential. There's studies that have been done that show that they spend approximately $7,200 per year on caregiving to support loved ones. Nearly 60% are working, and so many of them are forced to cut hours and leave the workforce entirely to provide care for their loved ones. Research shows that caregiver tax credits help them stay afloat. Really, essentially, it also helps them keep loved ones at home, so where people can be healthier, safer, more connected to their communities and their families, and have greater recovery, greater healing opportunities, greater medical opportunities, so greater health care, greater care overall. We have a rapidly aging population. We think this would take this opportunity to honor our caregivers would be wonderful. So thank you for hearing this bill, and hope you move it forward.
Thank you very much, Chris. Kobe Chalk, Alzheimer's Association of Hawaii, in support. Thank you very much. Tanya Machika, Tax Foundation of Hawaii, please proceed.
Aloha, Colleen Taramai for Tom Yamachika, the Tax Foundation of Hawaii, stands on its written comments. Mahalo.
Thank you. Eric Abe, Hawaii Primary Care Association, in support. Cecilia Fong, Hawaii Care Association of America, Hawaii Chapter, in support. Amber King, Leading Age Pacific West, in support. Hawaii Children Action Network speaks in support. Aloha Independent Living Hawaii, in support. Rick Tabor, in support. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 individuals, all in support, and ALS Network in support. Anybody else wishing to testify on HB 1972? Members, any questions? Okay, seeing none, moving on. HB 1973. First, relating to health. First up, we have Shifta in support.
Aloha, Senator San Juan Ventura, Kyoho Kalole. Thank you for listening to, I'm going to try to get this under 1 minute, which I will. Kupuna Aloha is a new project. It has two arms. One is being funded by Rural Health Transformation Program. This one would be for the non-rural Kupuna beneficiaries. This provides primary care extension into the home for those who don't have it, which are the Medicare beneficiaries, which doesn't cover home health. These are for frail and high-risk folks. We are going to try to keep these folks out of the emergency room, where we lose $700 per visit for most of these clients, and out of the hospital. The program is going to be, the front line will be volunteers who will be trained by a home health agency, vetted by them, and then they'll be supervised with iPads connected to advanced practice nurses and social workers to provide care for these folks. The cost is less than $1,000 per year per beneficiary. This pilot will cover 2,000 people. It's a super program.
Thank you very much, Dr.
Super
Lloyd.
program.
Yes, I'm sure it is. Okay. Cecilia Fong, Home Care Association of America, Hawaii Chapter, in support. Leland Brady, Aloha Independent Living Hawaii, in support. Maria Reza Morales, Project Dana, in support. Department of Health, in support. Hey, Lauren, you have 1 minute also.
Good afternoon, Senators. Lauren Kim from the Department of Health. We support this measure for the same reasons that Dr. Lewin described. We are optimistic that CMS will send us written approval for this for a rural focus RHTP, but we haven't received that yet. It is part of the budget period one priorities, but we can't expend any money until we receive the written approval. But we are optimistic that we're going to get that shortly. So just a heads up for budget planning.
Okay.
Thank you.
Rick Tabor in support, Johnny May Perry in support. So Lauren Kim, I have a question for you. Okay, so you're in support of the bill even though you guys don't have funding through CMS approval.
We are optimistic that we will receive that written
So unlike
approval.
the Department of Human Services regarding getting CMS funding for something that they already have approved, you want this bill and even if you don't have funding?
I think it is prudent to keep this moving. Although we are optimistic, this bill may be an opportunity to have an urban-focused Kupuna Aloha program in parallel with the rural-focused Kupuna Aloha program, should the legislature so decide.
Okay.
Yeah.
So my last question is going to be for Shipta. Come on in, since you really want it. Okay, is it part of your budget, since you don't have CMS approval?
Well, we believe we'll get it for the rural health transformation in the neighbor islands. This is for
So
kind
you
of
got
sort of.
that one approved?
Well, Senator Moriwaki's whole group wants this for urban people as well, because that's where the majority of these beneficiaries are. CMS is sounding very positive about it. They haven't approved any of these detailed programs yet. They're just, that's slow for rural health transformation.
You got to get Meredith working for you.
Yeah.
Okay. Anything else?
She's fantastic. This one, though, is really going to be focused on the urban folks who'd be left out of rural health transformation.
Okay, thank you
Thank
very
you.
much. Okay, any other questions? Are we ready to proceed with decision making? Okay, so first up, HB 1626. Chair's recommendation is to pass with amendments. Technical non-substantive amendments need for clarity and consistency, and changing the effective date to upon approval. Any comments, questions, concerns? Seeing none. Acting Vice Chair Senator Kanuha for the vote. Chair votes aye.
Chair votes aye. Senator McKelvey is excused. I vote aye. Senator Keohokalole.
Aye.
Senator Favela.
Aye.
Chair recommendation is adopted.
So for HB 1643, Chair's recommendation is we're going to accept Kaiser Permanente's proposed amendments, and so we're going to pass it with amendments. We're going to note that there is still a defective date, so we urge the Corisanders to continue to work on this during the, while it goes to next, before conference. Okay, any comments, questions, concerns? Seeing none, pass with amendments. Chair votes aye.
Noting Senator McKelvey as excused. Any other members voting with reservations? Any no votes? Chair recommendation is adopted.
For HB 1668 HD1, a similar Senate bill was heard earlier regarding the Medicaid buy-in. Since CMS has already approved it, I am loath to pass a bill which is unnecessary at this time and thereby tying the legislator into the future. And for those reasons, we are going to defer it, even though I am supportive of Medicaid buy-ins and income disregard. So HB 1550, relating to health, Chair's recommendation is to pass with amendment. We are going to change the defective date to upon approval. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Pass with amendments.
Noting Senator McKelvey as excused. Any other members with reservations? No votes. Recommendation is adopted.
So for HB 1974, Chair is going to note that there is a blank appropriation for fear that it may pass with a blank appropriation. We are going to pass it with amendments, change the defective date to a different one of January 1, 2050. Any comments, questions, concern? Pass with amendments.
4 members present. Any reservations? Any no votes? Recommendation is adopted.
So for HB 1858, seeing no opposition, we're going to pass it with amendments. We're going to change the defective date to upon approval. Any comments, questions, concerns? Seeing none, pass with amendments. Chair votes aye.
4 members present. Any reservations? Any no votes? Recommendation is adopted.
Okay, HB 1871, Chair is going to note the blank appropriation. So we're just going to change the effective date to January 1, 2050. So pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Pass with amendments. 4 members present. Any reservations? Any no votes? Recommendation is adopted.
Okay, for HB 1966 HD1, Chair's recommendation is we're going to pass this with amendments, technical, non-substantive amendments needed for clarity and consistency. And I hate to do this to you, but I'm going to remove the cigarette tax revenues on subsection 3, page 5. I don't see any nexus to that. So pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
4 members present. Any reservations? Any no votes? Recommendations adopted.
For HB 1972, we are going to pass this with amendments. We are going to accept somebody's proposed amendment to add an expense of, quote, professional home care services provided by a licensed home care agency to page 8 as an additional expense, a different effective date of January 1, 2050. Note the blank appropriation. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
4 members present. Any reservations? Any no votes? Recommendation is adopted.
Okay, for HB 1973, Kupuna Aloha, we're going to keep this moving per everybody's request. So we're going to be passing with the amendment of the Home Care Association request regarding Medicare, Medicaid, and other government, to change, to remove Medicare and change it to Medicaid and other government assistance. Because, excuse me. Excuse me. The notes here didn't actually reflect. Whatever the Home Care Association's proposed amendment is, passes with that. Because we're going to note that Medicaid already pays for home care, so it doesn't make sense to have a Kupuna Aloha program for Medicaid. So it is for Medicare and other government assistance is the request. So we're going to make that change, okay? Any comments, questions, concerns? Seeing none, Vice Chair. Excuse me? No, I don't want that. I will let them. Thank you. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Pass with amendments.
With amendments. 4 members present. Any reservations? Any no votes? Recommendations adopted.
Okay, and with that, we are adjourned. Thank you, folks. And